I think it's obvious to us that the current control model is not working. COVID-19 has a very long incubation period, and before anybody showing symptoms, it's already spreading to many. And the current model is very bad for the economy, with quarantine, lockdown, and also social distancing are all very bad for the economy. What I'm suggesting here is for every citizen to take chloroquine to prevent COVID-19.
With hydroxychloroquine, this potential therapy for people who are infected with coronavirus, is there any evidence to suggest that, as with malaria, it might be used as a prophylaxis against COVID-19?
No, the answer is no. And the evidence that you're talking about, John, is anecdotal evidence. So as the commissioner of FDA and the president mentioned yesterday, we're trying to strike a balance between making something with a potential of an effect to the American people available at the same time that we do it under the auspices of a protocol that will give us information to determine if it's truly safe and truly effective. But the information that you're referring to specifically is anecdotal. It was not done in a controlled clinical trial, so you really can't make any definitive statement about it.
There is a control experiment conducted by University of Oxford. However, the result from this experiment would be announced sometime in April of 2021.
Peter, I'm not saying it will, but I think that people may be surprised. By the way, that would be a game changer. But we're going to know very soon. But we have ordered millions of units. It's being ordered from Bayer, and there is a couple of companies also that do it.
Indian Council for Medical Research has recommended hydroxychloroquine as a preventive medication for high-risk population.
The FDA is working very hard to get it out. Right now, in terms of malaria, if you want it, you can have a prescription. You get a prescription. And by the way, and it's very effective. It works. I have a feeling you may, and I'm not being overly optimistic or pessimistic. I sure as hell think we ought to give it a try. I mean, there's been some interesting things happened and some very good things. Let's see what happens. We have nothing to lose. You know the expression? What the hell do you have to lose? Okay?
So what do you say to
So instead of waiting for a year for the clinical study to complete, we can look into large population that's already taking chloroquine to prevent malaria. These countries are India, Pakistan, Indonesia, and Brazil. Here we have two maps. The one on the right is the high-risk area for malaria, and on the left is the countries that have COVID-19. You can see the two map doesn't overlap. If you look at the malaria map on the left, African nations with malaria are in the middle of the continent. On the right, you can see the African nations that are with COVID-19, and you can see is on top of the continent and the bottom of the continent. Here's a data sheet. You can see on the far right is a column with total cases per 1 million of population. So instead of looking at the total case, we divide it by the population so that you can see it clearly. So how well each countries are doing. For the non-malaria countries, you can see they are mostly 3-digit to 4-digit, maybe exception in China, but I think nobody trusts China's data. So you can see also on the bottom, the malaria countries only have 1 digit to 2 digit numbers. And there was a Chinese article back in February the 10th saying that the Chinese are very impressed with the Indians because they are very close to China and also have similar population. And they had 3 cases back then and kept it for a very long time. And also through February the 6th, there was 138,000 passengers from 1,265 domestic and international flights. They screened for COVID-19 and not a single case was detected. That is likely because all the foreigners, before entering India, they would take chloroquine 1 week ahead. So it's likely because of that there's no single cases. And also out of the 700 Indian nationals evacuated from Wuhan, and there were not a single case either. So the Chinese was very impressed. There's one interesting case with a group from Hong Kong that went to Mumbai in January 33rd to February 24th. Duration of about 24 days, and it was 21 members. And out of that 21 members, there's only 6 got infected. One of the reasons is that the group has taken chloroquine because it's highly recommended by the Hong Kong government that before you go to India, you take chloroquine 1 week before the trip. This 2 group offer a very special opportunity for us to study the effect of chloroquine. And just happened there's 6 member of this 2 groups has infected COVID-19. And also by comparison, we have 2 other groups. One group is a hot pot gathering, which with just 1 meal, there were 11 out of 19 that was infected. And also there's another group, which is our control group, with Hong Kong tour to Egypt with 9 members. All 9 members got infected. On the bottom is the Mumbai group. The Mumbai group, there's 6 out of 21 members over the duration of 24 days. And there's a smaller group within them, joined them from the 4th to the 18th. Because the duration is longer than the usual incubation period of 14 days, the Hong Kong government considered this as an import case. Because the Indian first Mumbai case is on the 11th of March, which indicated by the red dot on the right. It appears that the groups was infected in Hong Kong or on the way, and that the effect of chloroquine prolonged the incubation period. Here we have the hot pot gathering scenario, and you can see in a circular table which is a typical Chinese gathering environment, and here we have one infectious source. For one gathering, it can spread to 10%, which usually sit next to the infectious source. If the same group have another gathering, which have the infected ones sitting next to the infectious source, and the second day you basically have everybody infected. And now we have another scenario, which instead of meeting on the second day, the same group meet in the day 5. So the infected ones now become infectious source. So instead of just one source, now you have 11 source. So basically impossible for the uninfected one to be missed. Here we have the two group directly compared to each other. On top is the Egypt tool, and the bottom is the mobile tools. And we only listed 6 members of the mobile groups, and this is what the data we can get. We prefer to get more information for the uninfected ones, but right now we cannot get a whole of them, so we're only comparing all the infected ones on this chart here. You notice on the right hand side, the numbers are smaller for the confirmed minus the symptom date, and also the confirmed minus trip end, which the end of the trip, the time between the end of the trip to the confirmed time. So all of them are only very small 1-digit figures. So by comparison, you can see on the mobile group, these are all 2-digit figures. Also notice on the mobile group, there's 2 asymptomatic cases, and you can see the date confirmed to the trip end date are 17 days, which is very long. Finally, to make the decision, it comes down to 3 things: cost, safety, and efficacy. And in terms of cost, it can be as low as a penny a month for each citizen. For safety, there's hundreds of millions of Indians are taking it every week. So how unsafe can that be? But we have to be aware that if it's overdose, it can be lethal. For efficacy, we're discussing here is about prevention, not cure. I think the efficacy for cure is already proven. And I think in terms of efficacy is a relative thing. It's a scale. It's not a yes/no answer. For sure, here we can already conclude that it is effective. It does reduce the chance that you catch COVID-19 or reduce the severity if you do catch it. According to the data we got so far from the Indians, 10 to 20% of the citizens taking chloroquine is enough to reduce about 90% of the COVID-19 cases. I think the main problem with COVID-19 is the explosive effect it has on human body as well as the economy. If chloroquine can reduce that to a manageable degree, I think would be much better for everybody, and the casualty would be much less. I agree that we can go through a clinical study to find out, but for 1 year, that's way too long. I think to find out what the Mumbai group can offer, I think that's much faster. And from the numbers that I got so far, I think it's already tell the story that it is effective. And we should not wait for 1 year to move further. I think we give pressure to governments to change the direction of the control model to using chloroquine to prevent, and 2 pills for everybody each week will turn the economy around. Thank you.